Hello everyone, and today I will be discussing some memory based questions of INI CET 2020. So the first question, difference between the lowest and the highest levels in the data. What is the answer? Answer is range. Now best method to study previous research studies. So it is very easy. Answer is meta analysis. Now discrete probability distribution that expresses probability of a given number of events in a particular time frame. So this was a little confusing, but the answer is Poisson's. And other options were Gaussians and binomial. So Gaussians is not discrete. Binomial is discrete, but it is independent of time. So answer is Poisson's. Now the device used to tell the heat exposed in vaccines. So it is very easy. A vaccine vial monitor is used in vaccines for telling that heat exposed. Now image based question was asked. The pink cannula was there and they asked the size, so 20. Now image of the swollen foot with sinuses in a farmer. So farmer is the main thing, so mycetoma was the answer. Now affinity maturation is due to, it is due to hypermutation. So affinity maturation is due to hypermutation. Now diarrhea in Vibrio cholerae is due to disruption of zonula occludens. This is also easy. A repeated question. So diarrhea in Vibrio cholerae is due to disruption of zonula occludens. Now iritis is not seen in. So there were Behcet disease, ulcerative colitis, SLE, and rheumatic arthritis. The answer is SLE. It is iritis is not seen in SLE. Now for frontal sinus view, which view is good? So Caldwell view for frontal sinus, this is the answer. This is very easy. Now most common imaging finding of COVID. So diffuse alveolar hemorrhage, this is the most common imaging finding in COVID patients. Now patient with dengue, afebrile for 24 hours, hematocrit 44%, platelets are 14,000. So what should be the management? So IV fluids, 4 units of platelets, and oral fluids and observation. This is the correct answer. Now image of knuckle hyperpigmentation. Knuckle hyperpigmentation, so they asked deficiency. So it is vitamin B12 deficiency that cause knuckle hyperpigmentation. Now life-threatening complication of CKD, chronic kidney disease, is hyperkalemia. Hyperkalemia is a life-threatening complication of CKD. Now Rees-Eicher fluid is used for which thing? See, WBC or RBC, very much confusing. So it is RBC. Now false about lympho-predominant Hodgkin lymphoma is poor prognosis, but the real thing is true is that it has a very good prognosis. Now JAK2 mutation seen in polycythemia vera. This is the answer. Now T1114 specific marker for which of the disease? So mantle cell lymphoma, also cyclin D1 and SOX11 is included in this. So mantle cell lymphoma is the answer. Now markers which increase in 2 to 4 hours in myocardial infarction. So the answer is CKMB. In 2 to 4 hours CKMB markers are raised. Now drugs not used in severe COVID. So favipiravir is not used in severe COVID. Many of you have marked dexamethasone, but that is not the answer. It is used. Favipiravir is not used. Now drugs that worsen myasthenia gravis. So lidocaine is the drug that worsens myasthenia gravis, and this is the answer. Now antidepressant with least sexual side effects. So mirtazapine is the answer. It is the antidepressant with least sexual side effects, mirtazapine. Now drugs causing chest pain in 50-year-old males, migraine drugs which cause chest pain in 50-year-old males. So ergotamine is the answer. Now bone forming drugs, the teriparatide, calcitonin, and raloxifene. Very confusing, but the answer is only bone forming they asked. So teriparatide is the answer. Now best imaging biliary for biliary leak, which is the best imaging thing you will be using. So the answer is MRCP. MRCP is used best imaging for biliary leak if you need to diagnose that. So stay tuned. I will be solving, if I get more questions I will be sharing with you, and if you have any doubt, any query, if new questions, you can comment below. Thank you.